Hello.
Hello, sir. Thank you for joining us.
Huh.
We will start in 1 minute.
Okay.
Good evening, everyone. I am so happy to see you all in this session today. So we have this session on ICMR STS 2024. We have received so many requests from all our juniors who are aspiring to apply for this cycle of the ICMR STS. This would not have been possible without Joitali Nath, the president of GAMS West Bengal, and Sautam Bhattacharya, our VP Activities, and Dr. Shoumudip Das, the Assistant State Director of RASOG under GAMS West Bengal. I am Riddhi Mondal, the State Director of RASOG, GAMS West Bengal, and I am glad to welcome our speaker for today, Professor Dr. Amitava Chatterjee. Dr. Chatterjee did his MBBS from NRS Medical College, followed by an MD in Community Medicine from All India Institute of Hygiene and Public Health. He did his MRCP from Royal College of Physicians, London, UK. He has also done a diploma in management of diabetes, thyroid disorders, and non-communicable diseases from Mohan's Diabetic Clinic, Chennai, and Public Health Foundation of India. He is a lifetime member of IAPSM, Association of Physicians of India, Research Society for Diabetes in India, and Cardiological Society of India. Sir has been teaching undergraduate students and postgraduate medical students for the last 14 years and is presently the associate professor at Midnapur Medical College. He has more than 20 publications in international and national journals. Sir, thank you so much for hosting the session today. We will have a short Q&A session at the end of your speech, and we will send a link in the chat. This is for all the audience. We will send the link in the chat for the Google form, which you will have to fill so that you can get your participation certificates later on. Thank you. Over to you, sir.
Thanks a lot for the nice introduction. So, we shall be starting our topic today directly. First, let me introduce myself. I am Dr. Amitavo, and I think all of you are students of different medical colleges. Is that so?
Yes, sir.
Okay. So, the topic is ICMR STS project. So, I think you all know what is ICMR, Indian Council of Medical Research, and they do a lot of research in biomedical sciences. So, what is STS? I would like to make this discussion interactive. Okay. So, students, I would like to ask you all some questions during the discussion, and let us make it interactive. Let this not be a didactic lecture as we do in classes. So, do you know anybody what is STS? The full form?
Sir, it is
Anybody?
short-term scholarship.
Not scholarship. It's
Yes,
studentship.
studentship,
Studentship,
short-term
sorry, sir.
studentship.
Okay. So, what is the purpose of this short-term studentship? Why did ICMR start this short-term studentship? When we were students, such initiative was not present. Actually, ICMR it is one of the leading research institute of India. Nowadays, government of India and all the research institute they are wanting that students of different medical streams of engineering streams they participate more in research oriented activities. So for that they initiated this STS project where they welcome students to give their innovative idea in a project form for, and if they get selected there is definitely a appreciation certificate as well as a stipend. So that was the initial idea of this STS project. So this STS project is carried out once every year. Specific time and guidelines are available in their website. So when you will be applying, definitely go through those regulations very carefully regarding the dates, when to apply, all those things. So let me just summarize in a small in few lines what actually happens during this project. First, a notification is given from ICMR that they want students to place their protocol to them, so that they can select any one of those protocols to be converted into a 2 months short term project. So after the website issues the notice for the welcoming the protocols, students have to submit their protocol as per their norms to their website. So these norms are very important, so that your protocol is selected for the ultimate project. We have to follow the norms as prescribed by ICMR line by line. So actually here comes the part of research methodology. So a student who is willing to submit one of his proposal to ICMR for getting selected in STS has to have some knowledge regarding research methodology. This is of foremost important, that how to write a protocol, because ultimately when the selection will be carried out by ICMR, it will be done on the basis of the points which they have mentioned in their website regarding how to write a protocol. So we will coming to that later on. So after you will write a protocol, you have to select a guide from your own institute or any of the faculty members of your college. So that guide will help you regarding the protocol part. Now remember one thing is very important, that as per ICMR norms, one faculty can guide only one student. So if one faculty has selected or become a guide of one student, another student cannot approach that faculty. You have to select some other faculty. So after you select a guide, you prepare your protocol as per discussion with the guide. Thereafter, you have to submit that protocol to ICMR. Meanwhile, you have to place your protocol to the ethics committee of your own institution for approval. This is also very important. So now after submitting your protocol to ICMR, ICMR will go through the protocol, and if you are selected, it will be notified over mail as well as in their website that you have been selected to carry out this STS project. Now remember one thing, as I was discussing, that when you are submitting this protocol to ICMR, as well as during that time, you have to apply for the ethics committee clearance. This is very important because once you get selected, ICMR will notify you that within a period of 2 months, starting from a selected date as given by ICMR, this project which has been accepted by ICMR has to be completed by the student within that 2 months. So your ethics committee approval has to be obtained at the time of submission of the protocol or within that 2 months during which you are carrying out the project. No ethics committee's clearance will be accepted by ICMR after the deadline as given in their website or during or after the submission of your project. So even if your protocol, your topic is very good, it has been accepted by ICMR. If your ethics committee clearance is not obtained within the stipulated time, your STS project will remain cancelled. Is that clear to everybody?
Yes, sir.
So,
Yes,
so
sir.
ethics committee clearance is very important, and I suggest my students, when you start writing the protocol, after your guide gives okay to the protocol, as you are submitting the protocol to ICMR, during that time submit the protocol to the ethics committee of your own medical college, so that before the final result comes out, you get the clearance for the protocol. You have the protocol clearance regarding the protocol in your hand. Okay.
Sir,
Okay.
sorry to interrupt.
Yes, sir.
Uh, can you please
Yes.
turn on the video? It will be better to interact.
Okay. Okay. Just hold on. Just hold on.
Yes, sir. Thank you so much.
Okay. So after you submit your protocol along with the ethics committee clearance to ICMR, if you get selected, then you will get 2 months time to complete the project and do the final submission to ICMR. And as your project has been selected, you shall be getting a certificate as well as a stipend. So this is the whole thing in gist. Now we are coming to the, as I was talking, regarding the research methodology. Those who have already done their community medicine already know how to do a project. They have got some idea. But a first year or second year student who has just entered community medicine, it will be difficult for them to know how a project is done. So we shall be giving some basic idea regarding that today. So so the steps through which we will write the protocol are as such. First, you have to select a title. The title of the project which you are selecting, or that is very, very, very important. Everything actually will depend on your title. So how to write a title? Remember, a title of a project, it should be within stipulated number of alphabets or words, number one. Number two, the title of the project will give us an idea of the important theme which you are trying to communicate. For example, you are trying to do a study on diabetes mellitus. So the word diabetes mellitus has to be on the title. Number three, what is the place in which you are carrying out the study? So the title may give a small idea regarding that thing also. So the title has to be specific within limited alphabets or words and should pertain to the specific objective or the main idea that you are trying to give to the audience. So after selecting the title, then you have to go to the introduction part. So what we actually write in the introduction, the importance of the topic which you are selecting, the importance of the topic. Remember, introduction always goes from just in the way of a inverted pyramid structure. In introduction, in the first 1 or 2 paragraphs, you write details about the topic which you have selected, which is important, and as you go down, you come to the specific part of the topic in which you are focusing on. For example, diabetes is a huge thing. It is not possible for a student to do every aspect of diabetes study in one single paper. So he is starting, when he is writing the introduction, he is starting from the broader part, and as he is descending in the introduction part, he is coming to the specific part in which he is focusing in his research study. So after writing the introduction, you have to go for the review of literature part. So what is review of literature? In review of literature, after introduction, you have to go to the objectives, then comes the review of literature. So after writing the introduction, you go to the objectives. Now, what are the objectives of your study? Remember, selection of a topic in ICMR STS is basically dependent majorly on two parts, because you are submitting the protocol, not the actual study. You don't have any results. You have the idea. So mainly the ICMR personals will look at your title and mainly on the objectives. So your objectives, when we talk about objectives, we generally divide the objectives into two parts. One is the general objective part and another is the specific objective part. So make your objective very smart. What is smart? Can anybody tell? Can anybody tell what is a smart objective? You have studied in your MBBS classes. Those who have done community medicine. Anybody?
Specific.
It is SMART.
So
SMART.
something which can fill the lacuna in the existing medical knowledge.
No, that will come under introduction and review of literature. I am talking about objectives. So it is applicable for any biomedical research study. So S is specific. Your objective has to be specific. What is M? M is your objective
Measurable.
should be measurable. What is A? Your objective should be attainable. What is R? Your objective should be relevant. And what is T? Your objective should be time bound. So these are the criteria which one's objective should fulfill. For example, I am giving you an example. A student is thinking to do a genetic study in relation to liver cancer and place that protocol in ICMR STS project. Do you think this study will be accepted by ICMR? It's an excellent study. Or some study in relation to genetic issues in type 1 diabetes. Do you think ICMR will accept this study? Excellent topic.
It's
No
not
doubt about
realistic.
that. Exactly. We don't expect a student to do a 2 months project on genetic issues of diabetes in their medical colleges. That is neither specific, neither measurable, neither feasible, neither attainable, neither time bound. It cannot be done in 2 months. So when you are selecting a title and objectives, remember the smart points. So when we are describing the objective, first comes the general objective and under that comes the specific objectives. I suggest to my students, keep the objectives maximum to 2 or 3, not more than that. Because more number of objectives will lead to more number of tables, and it will not be possible for you to do all these things within a period of 2 months. So after objectives will come the review of literatures. Then what is the review of literature? So for example, I am thinking about doing a study on maternal mortality, death of mothers in hospital. So I have to go through some review of literature. So what is that? In review of literature, we shall be trying to focus on previous studies in relation, which has got relation to my study or similar type of study. What are their results? How did they do their studies? What were their interpretation? Will the interpretation of those studies will be closer to my objectives which I am selecting? So in review of literature, you have to do some review of records, review of previous studies. So after review of literature will come material and methods. Material and methods is the heart of this STS project. So material of methods will have a number of points like place of study, type of study, period of study, sampling technique, sample size, what are your variables, what are your inclusion and exclusion criteria. All these things will come under the material and methods part. After material and methods will come the how will you statistically interpret the study you have selected or the data which you have collected. A brief 1 or 2 line regarding the statistical part you have to also write. So these are the basic points which you have to include in your protocol. And the last another thing which I missed, that is the references. You have to in the what are the references? Any part which or any idea if you have taken from any other study and you have mentioned in the introduction part or the review of literature part, that has to be mentioned in the reference section according to some certain styles like Vancouver style that you can find out after going through any medical journal. So these are the when you are writing a protocol, you must have to touch all these points. If you deviate from this chronology, your project will stand cancelled in the initial screening itself. So when you will selecting a topic, select a topic. You don't have to select a topic which is very flashy or very rare, or definitely it's very important, but it does not or it cannot be done within the next 2 months. So select a topic which can be easily carried out, where you will be able to interpret the data which you are collecting easily and which is feasible in your hospital or in the community nearby your hospital. So select a topic in that way and thereafter write the protocol touching all these relevant points. Is it all right for the students? Any questions here?
Sir, I have a question.
Yes.
Sir, how will the review
First introduce yourself.
Sir, my name is Shubham Nath. I'm a second year MBBS student.
Okay.
Sir, how will the review of literature and the reference portions be changed? Like review of literature itself, we are studying a few of the studies. In the reference, do we again need to mention those studies?
No, reference writing is something else. For example, I'm giving you an example. I am writing a review of literature in this way that I want to study the one of my objective was consumption of alcohol in diabetic patients. It is one of my objectives to find out the consumption of alcohol in diabetic patients. So I am trying to find out, maybe I have found a study done in Mumbai where they also studied the similar thing and they got a certain result. So I am mentioning that such an study has been done in one of the medical colleges in Mumbai and they found out the prevalence of consumption of alcohol to be 20%. So you have to write that you got this information maybe from a journal called JAPI. The journal is that is a Journal of Association of Physicians of India. So you have to mention that you have taken this information from Journal of Association of Physicians of India. What was the name of the title of that paper? From which page did you take this relevant information? You will it is better that you go to the library, you open any of the biomedical journals. You will at the end of the journal you will find references are being mentioned, and there are certain style of writing the reference. Mainly in biomedical journals we use the Vancouver style. So in review of literature you will be mentioning such information that you have taken from any other journals in relation to your study. So you have to mention that journal, what was the name of the article which you consulted, from which page number did you take the information. So you have to mention all these things in your review of literature. Reference writing will mainly come in introductory part and the review of literature part.
Sir, so the review of literature will be a separate topic?
will be a separate topic. Will be a separate topic.
Okay, sir.
Generally, it has been said that in introduction, as I told, when we write introduction, it should be an inverted pyramid pattern, that I start from the details of diabetes mellitus, and thereafter I come to a specific thing which I am trying to find out. And review of literature, it becomes a pyramid shaped. I start with maybe the objectives of my study, and as I go down, I include many other information from many other similar studies from different journals. This is the difference between introduction and review of literature.
Okay, sir.
Okay, so when first students, you have to select a topic, make that topic feasible, easy topic which you can carry out. Discuss the topic with your guide, write up the protocol. Hello. So write up the protocol, check or review the protocol with your guide, discuss it with your guide, and thereafter you have to place the protocol to ICMR, and meanwhile place the same protocol with the ethics committee of your own medical college for the clearance of your study. So this is the basic idea of STS project. Now we can go for question and answers. Students, you can ask questions.
Sir, before submitting the project to the ICMR,
Yes.
how much percentage of the project do we need to complete? It is 80% or 90%?
0%. 0%.
So we need
Remember
to give
one
the
thing.
topic.
Remember one thing. What we are discussing is regarding the protocol. You haven't started the study yet. You are writing, you have got an idea, you have got a hypothesis which you want to prove. So for that, you are writing up a protocol that I want to do a study on thyroid disorders, and these are my objectives, and this is how I will carry out the study as written in material and methods. So this is your idea or hypothesis which you are placing it to ICMR. So ICMR may like it or may not like it. If they like it, they will select your project, your proposal, and they will tell you, okay, now we have accepted your protocol, you can carry on with your study for a period which has to be completed within a period of 2 months. Clear?
Okay, sir.
In the protocol, you cannot write any results because your study has not been approved yet. Neither you have carried out anything of your study. You have got an idea, and you are placing that idea in a certain proforma or protocol. That has to be approved by ethical committee as well as the ICMR. If it is selected, if it is approved by the ethical committee, then you will be getting 2 months time for data collection and making the final study and presentation. Clear to everybody?
Yes, sir.
Okay, any further questions?
Sir, I have a
So
Incidentally, over last 4 years, 4 of my students have got selected. So
that is amazing, sir.
okay, so I think many of you will also get selected. And remember, a lot of students get selected. There is no such any selection criteria that from Midnapur Medical College only 2 students will be selected. If you give good proposals, even 10-20 students may also get selected from the same college.
So before anybody else asks any question, I would request them to type them out in the chat box, and I will request our Vice President of Activities, Sautanda, to handle the question answer session. So over to you, Sautanda.
Thank you, Riddhi. Hello, sir. Let me take the questions
Hello.
for you. Okay. So, Khushi Prajapati is asking, sir, what type of study do you recommend? And what is the usual time period for registration and results of ICMR STS.
Okay, okay. Firstly, what type of study I recommend? To know what type of study, you have to have some basic idea regarding what are the different types of study that we know or we do. For example, I think those who have already crossed community medicine do have some idea. What we say, it may be a cross-sectional study, it may be a case control study, it may be a cohort study. So remember, as I was telling initially, the time period which will you get is only 2 months. So within a 2 months period, it will be very difficult for a student to do a case control study or a cohort study. So keep it very simple. Firstly, always go for a cross-sectional study. What is the meaning of a cross-sectional study? I am studying my population or the unit of study only once. From there, I am collecting data and I am making some tables and presenting the facts. So I would like my students, see, ICMR does not want to see how much you know or how brilliant you are. The purpose of this ST is that whether the students know research methodology or not, they are actually trying to make you interested in research. So I would like my students to do a cross-sectional study, which is very easy to do within a period of 2 months. And what was the next question?
So what is the usual time period of registration and the results of ICMR STS?
Oh, okay. That actually all those things are notified in the website of ICMR. Once you, I think this year's result already has come out, and they have to submit the project within next 2 months. So similarly, in 2024, I think you will be getting the notification, initial notification in the month of September or October. After you get the notification, you have to write up your project and submit it within the time frame. After submitting, most probably in the month of November or December, the result will come out. After the result come out, you will get 2 months time to complete the project and do the final submission. Clear?
Thank you, sir. Let me take the next question.
So be very alert regarding the notifications which comes out in the website of ICMR.
Yes, sir. Sir, the next question is from Khushi Bhatia, who is asking,
Okay.
sir, can the study be chosen and the ethics approval for the 2 months if we want to continue the study further? I
Yes,
didn't get
that
the
can be
question.
done. That can be done. See, don't confuse the ICMR STS project with any other further project which you want to do. If you want to, for example, I am explaining this with the help of an example. You want to do a study on hypertension, which you want to submit to STS. So you write up, you have written up the protocol and you have taken the ethics committee clearance. Ethics committee will give you a clearance for this particular topic for 2 months only. So you have submitted to ICMR the project which has been selected. So ICMR has given you a certificate, you got the stipend. Your project ends after 2 months. Now you want to carry out further, you want to further increase your sample size, you want to carry this project for another 2 years. You have to take a fresh ethical committee permission that I will carry out this project over next 2 years with the same objective or with some additional objectives. So a new ethical committee clearance or certificate has to be taken. Clear?
So, the same 2 years ethical committee clearance cannot be applied for the 2 months of ICMR?
No, absolutely not, absolutely not. ICMR is very strict regarding all these things.
Okay, sir.
You cannot violate whatever written in their website, because there strictly it is written that if you want to carry out further studies with the same topic or the same project, you have to take fresh ethical committee clearance. You can and you can continue.
All right, sir. Thank you.
Okay. Okay.
Thank you, sir. I think Kushi has got her answer. So let's get to the next question. It is from Ipsa Parveen. She is asking, sir, how should first year and second year students select a relevant topic, given as they don't have the clinical exposure that much?
Okay. First year and first, how to select a relevant topic. Actually, there comes the importance of a guide. Every student who is applying for a STS project has to select a guide. So, according to myself, I always first let the student think what idea do they have, because what we are doing here, we are converting an idea to a research proposal. So, first I let the student think, give me some idea, you give me some idea which you think you can do. Thereafter, the guide gives his input or output. So, there are plenty of ideas which can be done. For example, since you are in a hospital setup, you can think about going for clinical aspect, like think about hypertension, think about diabetes. There are certain aspects which are separate from clinical ideas, like you are going to the hospital, you can think about a lot of patients are coming to the hospital. Why don't you think about satisfaction of those patients? Are they satisfied with the services which you are getting in the particular hospital? That can be done out in the OPD. So, there are another very simple thing. Children come to the pediatric OPD. Do children know the importance of hand washing technique? Do they know hand washing technique? Think about very basic things. ICMR appreciates very basic ideas because they are wanting you know how to do a research. So, think about basic ideas. It will be easy to do. Your protocol will be with less error and gets more chance to get accepted.
Thank you, sir. The next question from Rakshanda is, sir, review is the results of other on my topic. She's asking what is a review of literature is.
Okay, since in protocol, your results had not been generated. You have got an idea, you have got a title, you have got an objective, but your results are not there. So you are trying to find out what sort of results similar studies carried out maybe in your college or in separate institution. What are the results in that studies? So, when you will be writing the final project report, you will be comparing your results with results of those studies carried out in other institutions or in your institutions. So, that is the importance of review of literature, because see, I cannot think that my study is the best study or my study is so unique that it has got no competition. It does not work in that way, especially since this is a learning issue, this is a learning project for you. So, whatever topic you select, definitely there has been other studies also in relation to your topic, in relation to the objective you have selected. So, try to find out those information, and in review of literature you are comparing or you suggest to compare your objective with those objectives of other studies where results has already been obtained. For example, I am giving you an example. I am trying to, my objective is that I am trying to find out the burden of pre-diabetes among a community in West Bengal. So, to be more specific, in a community of Kolkata or among the adolescents of Kolkata, to be more specific. So, now this is my objective. I do not have got the results because my study has not yet started. Now, in review of literature, I will try to find out whether similar study measuring the prevalence of pre-diabetic among adolescents in metropolitan cities, other metropolitan cities of India are there or not, and if present, what were their results, what amount of pre-diabetic did they find in a study among adolescents in Pune or in Chennai or in Hyderabad or even in Kolkata. I will write that in my literature, because if my study is selected, this thing will be elaborated and compared in details in my final project report, because then my own data has been generated. Clear?
Thank you, sir. The next
Okay.
question is it applied for dental stream also?
It's applicable for any biomedical research, including dental science.
So the next question is, sir, can you please mention the topics under materials and methods? From Shubham Nath.
Please elaborate the question.
Sir, mention the topics under materials and methods.
Okay. The topics under material and methods. So in material and methods, first we have to, the number one topic is what type of study I am doing. Number one is what type of study. Number two is the study design. As we were telling, is it a cross-sectional study or is it a longitudinal study? What is the meaning of longitudinal study? In a study in which I am following up the patients. Maybe I am visiting the patients every 7 days or 15 days. That becomes a longitudinal study. Number three, what is the place of the study? Where I am carrying out the study? What is the time frame, expected time frame? Okay, another very important thing, when you are writing the protocol, you have to write in future tense, because here the study has not been carried out. You are placing a proposal for the study to be carried out in future. So remember, always you are writing in future tense, and when you will be writing the final report, then you will be writing in past tense, because then the study has been completed. So place of study is important, time frame of study, time of study is important. Then comes what is your sampling technique. Sampling technique means the population in which you are carrying out the study, in what way you are carrying out, what are the different sampling techniques you know about. Can anybody say me, give me an example? Anyone?
Random sampling, systematic random sampling, cluster sampling, snowball sampling.
Excellent.
Stratified random sampling.
So at least you should have some knowledge regarding these particular points. So what sampling technique you have selected? Next comes the sampling sample size. What is the sample size of your study? For example, you are selecting, you have planned to study pre-diabetes among all the first year and second year medical students of your college. So what is the expected number of students? That is 400. So you are taking all the 400 students. So what type of sampling? This becomes complete enumeration. So my sample size is 400. I have done complete enumeration. I have taken all. So sample size, then after sampling technique comes sample size. Thereafter will come the what are the inclusion and exclusion criteria. What inclusion and exclusion criteria you have selected for your study. So what is the meaning of inclusion and exclusion criteria? Are they same? Are they synonymous? Means I have in my inclusion criteria, I am taking all adult patients more than 18 years of age. That becomes my inclusion criteria. So will my exclusion criteria will become I have excluded all the patients below 18 years. Will that be so?
No, sir. Those people who are not willing to respond, they will be exclusion criteria.
Very good. So when, remember one thing, I may write only inclusion criteria, or I may write inclusion criteria or exclusion criteria where exclusion criteria will be different from inclusion criteria. For example, as you told, that I am selecting all the adult patients more than 18 years of age, but my exclusion criteria, those who are not willing to participate, those who are very ill, or those who have taken recently some drugs, these may be exclusion criteria, which may not be same with the inclusion criteria. So after inclusion and exclusion criteria, another thing is the study variables. What are the variables which you are selecting for the study? Study variables are again of two types, maybe independent variables or dependent variables. Then another thing is the operational definition. For example, I am doing a study on hypertension. So how would you define hypertension and its stages? So you should have an operational definition, because you may accept a operational definition given by WHO, or you may accept a operational definition given by American Heart Association. So it may differ. Another thing is that what are the study tools? What are the study tools you are using in your study? So what are the study tools? For example, I am doing a study on hypertension. What may be the study tool?
So BP instruments.
BP instrument, very easy. BP instrument is my study tool. Questionnaire, I am recording the blood pressure which we have measured in a questionnaire or in a schedule. That becomes my study tool. And then comes the study technique. How did I carry out the study? Did I visit the outdoor, or I went to the indoor, or I went to the immunization clinic? So there comes the I have to describe all these things under study technique. So these are the main points, and the last but not the least will come the how will I statistically interpret my results. Generally what we say in our protocol, we will enter our data into MS Excel, and then we will do the analysis with the help of any statistical software. So these are the points which you have to mention under material and methods. Remember, in the protocol, basically your title, your objective, your review of literature, your title, introduction, your objective, your review of literature, and your material and methods. These are the important points. Rest, after this will come the conclusion and references. But the selection of the paper will be mainly dependent on your title, on your objectives, and on your material and methods.
Thank you, sir.
Sir,
next-
I have a question regarding your current answer. Sir, what will be the difference between statistical interpretation and conclusion?
Conclusion is that in conclusion, statistical interpretation is different. In protocol writing, you are not doing any statistical test, but you have to write how you propose to do, or what type of statistical test you want to do. That you have to mention. Maybe I will represent my data in the form of frequency tables, in the form of finding out the significance and association. So these are the statistical way I will interpreting my data. And in conclusion, why are you doing the study? For example, I am doing a study on, I am trying to find out the prevalence of prediabetes. So my conclusion will be, with the help of this study, I will estimate the burden of prediabetes in a certain community in Kolkata. This is my conclusion. Okay.
Yes,
Next
sir.
question.
So there are a few questions on 2024 deadline, like when the proposal that has not been released, right? They are asking.
No, most probably it will be released. This year's result has been declared very recently. I think in the month of November or December, the 2023 STS. So after declaration of result, they will be doing those who have been selected, they will be doing the study for next 2 months. After completion of the studies, they will be submitting their final proposal. and after the submission of the final proposal they will be getting the certificate and the stipends. Because what is the surety that after selection you will be carrying out the study? It may be that you don't want to continue. And next year 2024, keep a watch on the website. It will come out most probably between May to August or like that.
Okay, I'm skipping next few questions because they are all based on the dates. So the next question from Jatin is how much impact sir STS will have on our resume?
This is a very important question. Very important. What is the purpose of doing STS? In fact, I will be sending another. I give you a information. 3 years back, I was then at NRS Medical College. There was a such sort of project competition among undergraduate medical students carried out by an institute in Netherlands. So 2 of our students, I was one of the guys, got selected. There were 2 or 3 rounds of selection. We didn't think they will get selected. They got selected, and 2 of them got fully sponsored travel for their final presentation and ceremonial receiving of certificate to Netherlands. Any sort of such student project is very important for your resume. Remember one thing, after passing your post graduation, if you want to go to any foreign countries to get a job or to carry out further studies in USA or UK, or even if you want to join medical education service in India, or you want to join in any major institution, academic institution in India, your research activity will hold prime importance. All of you will become excellent doctors. All of you will be looking after patients. But remember one thing, unless you have got research backup or your resume had got gets a number of research activities, you won't be accepted as a great physician or a great academician. For that you need research. And even when you are doing your postgraduate and PGship, or you are doing your DM or MCH, research is very important. In fact, recently in DM course, the number of research papers has been increased. Other than your clinical training, the number of research papers that has to be done in more number. So you have to know research methodology and you have to do papers. Any further question?
Yes, sir.
Sir, I have a question regarding your previous answer. So
Yes.
actually the registration dates, most of the in like the last years, the date was like at the end of January, but the registration dates are not out for this year. I have been looking for the dates since the last month,
Okay.
but I'm not
Visit the
able to find
website
it.
regularly. Whatever information will come out will come in the website. You will get all the informations in ICMR website. So keep visiting the website regularly. In fact, if any one of your friends come to know about the registration date, you will get the information, because registration has to be done in their website only.
Okay, sir. Thank you, sir.
Another thing regarding this, remember one thing, once the information regarding registration comes out, there are certain proformas which are available in their site, which you have to download, and you have to fill it up from the guide and the head of the institution. So that proforma, in that proforma, one place is for to be signed by the guide, and there is another place which has to be signed by the head of the by the principal of the institution. So at least do these things a little bit earlier than the cutoff deadline, because I have found students who are running after me and the principal on the last day of submission regarding these signatures. So at least do this a little bit beforehand, because You don't know, the guide may not be available on the day of final submission, or the principal may not be available, then you will be in a fix. So keep this thing ready maybe 3 to 4 days or 1 week before the last day of submission.
Thank you, sir. This is a very important information. The next question from
Okay.
Vaskar is, so suppose I want to publish my study in a journal after selection and declaration of results by ICMR. Can I make any
Yes.
changes or modification of the report before submit to the journal?
No. This is another very good question. As I was discussing, if you want to submit this study in any journal later on, remember, uh, ethically you have got a clearance for a certain topic with certain objective for a certain time period. So after the completion of your project, you may submit it in any journal, but with the same information or in the same format which you have done. Now, if you may submit it into any other journal with a larger sample size in a larger time period, but for that you have to take a new ethical committee clearance before doing the further, before adding the further information, and before submitting it to another journal in a newer format. So that is very important. If you want to publish it directly after your completion of your project, after the completion of the ICMR STS, you have to do in the same format which we have done. That you cannot change. If you want to change, you have to take a new ethical committee clearance.
Sir, as a follow-up to the previous answer, suppose we keep the same sample size, same study duration, just
Okay.
our interpretation of the results, like conclusion and all, or the data result will be same, but if we want to interpret it in a
Those
much
can be
better
changed.
way.
Those can be changed. Those are not the issues. The issue is that when, in fact, if you apply for the ethical committee clearance, you will find that the pro forma of the ethical committee clearance, there the title of your study will be given, there the place of your study will be given, all this information will be given. Good journals, okay, and there shall be a ethical committee clearance number. Good journals may want this copy of this ethical committee clearance report. So you may change the review of literature, you may change information in introduction, you may change your material and few informations in material and methods, you may change your the way you are interpreting the results, but you cannot change the title, the time frame of your study, the place of your study, the objectives of your study. These four cannot be changed.
Okay, sir. Also, suppose four students are doing study, not for the STS. Like four students have done a study, combined study under a guide. Now, suppose the lead author with the guide wants to give that study in the STS, and the study gets selected in the STS program. And now later, when they want to publish it in a separate journal with the name of all the four authors, will there be any issue for that?
Please repeat one thing, that you are telling that after the acceptance of the paper in STS, later on you are publishing this project in a separate journal,
Yes, sir.
but
Means for STS is
you are not
one-to-one.
giving the name of the guide.
No. Actually, sir, in STS there will be one guide per one student, and
Yes.
suppose the project has been done by combined by four students, and the lead
Yes.
author or lead student along with the guide are submitting it for the STS program. Now later,
Okay.
after the results of STS are out, so as to give credit to the
Can you
other students.
incorporate other members? The question is that
Yeah.
can you incorporate other members?
Yes, sir.
Yes, you can do it.
Okay. Thank you so much, sir.
You can do it, but you will be the principal researcher.
Yes. Okay. Thank you
You
so
will
much,
be the
sir. Thank you so
principal
much.
researcher, others can be included. Others can be included, no issues.
Okay. So maybe the last question from Shayan Ghosh.
Okay.
Sir, He's telling, I really struggle on the aspect of data collection, how to select a topic which will have a larger sample size. Otherwise, it becomes difficult and can be labeled as sporadic occurrences.
Uh, Firstly, as we were discussing initially, see, ICMR does not want that, neither they expect a student to do a large study or with a difficult objective, because the time frame is only 2 months. Within 2 months we have to do the data collection. So data, what will be your sample size will depend on the objective of your study. The objective should be specific, and the data collection has to be in relation to that specific objective. So remove this misconception that if I give a larger sample size, my study will be an excellent study. If you do a study with a small sample size, but the sampling technique and the sampling method are correct, and it is relevant to your objectives, which are nicely depicted in your material and methods, your study will be selected. Let that be very clear. ICMR here tries to view whether the student had understood research methodology or not, knows how to do a research properly. That is their objective. So forget about thinking about that, okay, agar, if I do a larger sample study, it will be selected. Absolutely not. Okay.
Thank you so much, sir. The ending
Okay.
statements will be given by Riddhi.
Okay.
Thank you.
Okay. Just to end from my side, so write up a
Yeah, sure,
protocol
sir.
according to the protocol guidelines as given in the ICMR site. You can open the site and you will find the points. Select one of your guides who will guide you regarding the whole project. So selection of guide and selection of the writing up of the protocol in a proper way actually leads to the selection of your study. So we can conclude.
Yes, sir. Thank you so much for this interactive and informative session. This is a first time, like I have never seen so many interested candidates turn up for a webinar. Thank you so much. And
Best of
this
luck to
was,
everybody. Best of luck to everybody. I wish all the students that you get selected for the project. Not only this project, in fact, another thing. I think Shomodip was communicating with
yes,
me.
sir.
There
Yes.
has been recently another opening in the Netherlands regarding another undergraduate research study. I have got the link. I will be sending it. I will sending that link to him. Please tell him to share that link with all of you, because it is for undergraduate medical students.
Okay, sir. Thank you so much.
Okay, thank
And
you.
maybe we could not take all the questions that the participants posted, but both Shomodipda and I have tried to answer all the questions
Okay.
because we have some experience with ICMR as well, ICMR STS as well. So,
Very good.
yes. Thank you so much, sir. And to the participants, we have already posted the link for the participation certificate. Please check that. So we can conclude the session now. Thank you, sir.
Thanks, and good night to everybody.
Thank you, sir. Thank you so much.
Okay,
Thank you, sir.
okay. Bye.
Riddhi, send the link once more in the chat box so that they can
Yes, yes.
fill for the
Okay, okay.
certificate. And keep it open for like 5 minutes up to 7:35 or 7:38 and close it. So I'm leaving. Thank you so much. Thank you, everyone.